Welcome to Health Talk. Today we're going to talk about prostate cancer. We have with us a urologist, Dr. Domenico Manzoni, who is going to tell us all about prostate cancer and what we can do about it. So welcome. What is prostate cancer?
Prostate cancer is the most common form of cancer that men today get. In the past, when smoking was more common, lung cancer would be the primary cancer in men. Today that we are seeing, fortunately, less people smoke, prostate cancer has become the most common disease, malignant disease that men can get.
Now, the prostate's about the size of a walnut, and tell us what what happens to it in this disease.
The prostate's function is to produce the majority of the liquid that comes out during sexual ejaculation. And it's located between the end of the penis and the end of the bladder.
Now, so when people have symptoms of prostate cancer, sometimes it's asymptomatic. What are the symptoms? When they have symptoms, it's late, right?
Yes, and this is the important thing. Prostate cancer symptoms are non-existent until the disease is far advanced. But many men, approximately a third of men, during their lifetime, usually in the 5th, 6th, and 7th decade, will develop symptoms related to the prostate. And these symptoms early on are indistinguishable from normal benign symptoms of the enlargement of the prostate as opposed to symptoms related to prostate cancer. The symptoms of prostate difficulties are increasing urination, increasing number of times that the man has to go to the bathroom during the night, slowness of his urinary stream, incomplete emptying of the bladder. But these are all mechanical symptoms that can be related to just enlargement of the prostate, which is treated with medicines or sometimes with lasers or other kinds of surgery, as opposed to the possibility of having prostate cancer.
So let's say you're a 50-year-old man, nobody's had prostate cancer, and what happens? What should you say? He's going for his physical, and so we're his family members. So what would he get? A prostate screening test, and what would that be?
We certainly hope he would get a prostate screening test. That, I think, is the standard of care in the community at this time. And that 50-year-old man, actually, we would prefer it actually starting at 45 years of age. And if there is a family history, because prostate cancer is a genetically related disease, if there's a family history, we would like to start the screening, the testing for prostate cancer at age 40. Right now, we have a test called the prostate-specific antigen. PSA. And this test has been in use for about 12 to 14 years in large use. It's not a perfect test. A perfect test would tell us yes or no and never be wrong. The PSA has many variables, and a normal PSA is good, doesn't absolutely guarantee that the person has no prostate cancer. 5% of people with prostate cancer have a normal PSA. An elevated PSA can be caused by, of course, prostate cancer. It can be caused by an enlarged prostate. It can be caused by an infection. It can be caused by a number of symptoms. It can actually be caused by if the patient had sex just before he had the prostate exam or the prostate drawn, the prostate blood test drawn. In fact, when the doctor does a PSA, he should always draw the PSA blood test before digitally with his finger examining the prostate.
So have the blood test first,
Exactly.
And then do the digital exam.
Exactly. Now the PSA, the importance of it is today, the way we use this, is we will have these values over time, so that if we see an increase rate of elevation of the PSA, then that's a question of alarm and causes us to study the patient more carefully. Now, this is how we define and find early prostate cancer.
So let's say a person comes in at age 45, has a normal PSA, and has no symptoms.
Yes.
But by age, and he has a yearly PSA done.
Yes.
By age 50, it starts creeping up.
Yes.
So then he would then see the family physician, who would then refer them to you, probably.
Yes.
At that point, what would this man expect?
Well, today what we would do at this point, if we would look back at his other PSAs to see if the trend was there, we would try and eliminate any other factors that might cause this PSA to go up: enlarged prostate, infection, other circumstances that could go up. We would probably repeat the PSA to be sure that that value is correct. And today we would add one new test that we do in the urology office, and that is something called a free PSA. A free PSA is PSA without an extra molecule in the chemical formula. And the relationship is that if there is a lot of the PSA in the free form, it's probably benign disease. If there is a small percentage of free PSA in that total PSA, we're more suspicious of a possible malignancy. So if I have a gentleman who comes to the office who had in the past a PSA of 2 and now he has a PSA of 4.2, just slightly above normal, and he has a free PSA of only 10%, that man needs to be studied at length and further. And that's done in the office with an ultrasound and at times with a biopsy.
Now, we've been discussing a particular case. So usually, for the whole population, prostate cancer occurs after 55. We want to tell us a little bit about that.
That's correct. Generally, prostate cancer is very rare in the 40s and becomes less rare in the 50s. It's usually a disease of men in their 60s and 70s. And if we look at all men in their 90s, a very high percentage of men in their 90s have prostate cancer. But when we look at the type of prostate cancer that those 90-year-olds have, it's an indolent, that is a slow-growing, very benign kind of prostate cancer that doesn't require any treatment.
Now, what are the new treatments that people can expect now if they're diagnosed? Because I'm sure you have to define the type of prostate cancer, the severity of the cell type. Tell us a little bit about that too.
Yes, in fact, what we do today is when we have an indication by the PSA or by the physical examination that there may be a problem, we do an ultrasound of the prostate. Ultrasound does not show us where cancer is. We're looking today for cancer which is so small that increases the chance of cure. It's so small that we can't see it on X-ray and that we can't feel it with our finger. When we look at someone's prostate with the ultrasound, it gives us a guide of where to do a biopsy with a fine needle through the ultrasound. And that biopsy is done on the surface of the prostate because we know that prostate cancer, early prostate cancer, starts on the surface. So the ultrasound doesn't see prostate cancer, but it tells us where to do our biopsies for the best chance of diagnosing, of hitting the target, which is essentially invisible because we're biopsying that portion of the prostate which most commonly has early prostate cancer. Once this is done, we have very important information. We know what kind of prostate cancer it is. And basically we can say today that there are 10 different kinds of prostate cancer. And these different kinds are classified according to Dr. Gleason.